All right, welcome everyone. My name is Danielle O'Connor. I'm a naturopathic doctor, and today I have Dr. Robyn Murphy here with me. Hello, Robyn. We are talking about preconception health as well as genetic insights. So this is a really interesting topic. Very excited to have Robyn here today. I will introduce you, Robyn, and just go into a little bit of what we're going to be talking about today. So, if you're just joining us now, today we're going to be exploring that topic of fertility and preconception care. We're going to take a deep dive into the significance of preconception care and its impact on your journey towards starting a family, right? Very important. We'll be talking about the impact of dietary choices, supplements, and really lifestyle factors on the impact they have on the maturation of eggs and sperm and how they can affect the overall health of your pregnancy. And then additionally, we'll be talking about the role of genetics in personalized treatment plans, as well as identifying potential predispositions that may actually impact fertility. So first off, a little bit about Dr. Robyn, who we have here. She is a fertility naturopathic doctor. She's at Conceive Health in Toronto, and she's also the scientific advisor for DNA Labs. So she really combines her strong background in research as well as clinical practice to bring the most effective treatment strategies for her patients. She's a strong advocate for patient-centered care and aims to build trust and empower patients with reliable knowledge to inspire health. She's also thrilled to be an ambassador for Fertility Matters Canada, which is amazing. And she is really most excited about supporting patients on a larger scale, right? There's a lot of people out there that really need support for fertility, and that's with her latest developments. So that includes her virtual fertility program, which is called Fertility Essentials, and her collaboration with Fern DNA and their launch of the first Canadian lifestyle fertility genetics panel. So this is going to be a great webinar. Thank you so much, Robyn, for being here. Welcome. Hopefully I was able to give enough information there on yourself and what you're doing right now. So super excited to have you here. And I think we'll get started if that's good with you.
Yeah, sounds good. Thanks so much for having me. I'm, as you can tell by all of my passion projects and everything that I'm doing, I'm really keen on the area of fertility and reproduction. And I just love sharing the knowledge that I learn and come across with patients. And I think the biggest hurdle that some patients have is trying to figure out, it's not so much where to get the information, it's what information is reliable, because there's a lot out there. And unless you have a medical background or a degree, sometimes it's hard to discern kind of what is the most important information. So I hope to touch upon that today for everyone.
Yeah, absolutely. Absolutely. So yeah, we'll get started. And really, I think the first question that we should ask is why is preconception care so important when it comes to fertility, and how does it influence the overall health of a pregnancy?
Mm-hmm. So I think just, defining preconception, if we just think about the term itself, preconception, it's the time period before conception occurs. So when that fertilization of the sperm and the egg come together, and then we get an embryo. And what people may not realize is for both sperm and egg, it takes roughly about 3 months for the full maturation process to be complete. So with women, we're born with all of the eggs that we're ever going to have. And with each cycle, those eggs are kind of coming out of the vault and starting to mature. But that's roughly about a 3-month process. So similar with sperm, it takes about 3 months for those immature sperm to make their way and form into the final product that we see typically on those images that are going to be able to properly deliver the genetic information and reach the egg and fertilize the egg. So we know that that 3-month period there are things that we do in our lifestyle. The way that I like to describe it is we have the microenvironment as well as our macro environment. So the microenvironment is, what are the nutrients, what are the hormones, what are the blood flow, how well is the body removing any sort of byproducts or, metabolites, all these things. We know that this can impact the quality of the sperm and egg. And then we also have the macro environment. So the hormones and, what the brain is telling the ovaries and testes, how well are they communicating? How in sync is the body? Are we having any exposures like cigarettes or alcohol or even caffeine that is known to have an impact on time to conception, but also the health of the pregnancy?
Yeah, that's a great information, and definitely something that a lot of people don't necessarily think about, right? So it's definitely important, that 3 month time span ahead of time. And that's why you're here and helping your patients. So amazing. How about some of the other factors that I kind of introduced? So in terms of like dietary factors, what are some of those dietary as well as lifestyle factors people should be considering when they're looking at improving egg and sperm, maturation and quality?
So we think about, what is the purpose of our diet? And our diet is to really nourish the body. So we want to be bringing in the nutrients that are helpful to regulate different systems that are involved in fertility and the maturation process, as well as those nutrients that are required for even protecting DNA from damage, things like antioxidants. So when you look at the data, the fertility diets that are out there they stem from the Mediterranean diet. So the Mediterranean diet, the purpose of it, or kind of the principles that we want to follow, is that you're getting a healthy serving of vegetables and fruits. So at least, 5 servings of leafy greens, sort of non-starchy vegetables, 2 to 3 servings of fruit per day, but avoiding juices. So you want the whole fruit. You're looking at including things like legumes and fish on a regular basis, and then bringing in those really healthy oils. So plant-based oils like olive oil, nuts, and seeds. These have anti-inflammatory components to them. They also help with blood flow. And we know that these oils, or polyunsaturated fatty acids, actually get integrated into the membrane of the sperm as well as the ovary itself. So it can modify the membrane of how it actually functions and works. So nuts and seeds are really important. And then we also focus on trying to, avoid more processed types of foods. So reducing the consumption of red and processed meats. So I always tell patients, especially during barbecue season, to limit that to once a week. You're kind of avoiding these sandwich meats or sausages, prepackaged meats, avoiding refined grains. So what that looks like is things that are highly processed. I call them the white foods. So it's like white flour, white rice, and anything made from these, right? So processed baked goods, pre-sliced breads. You want to stay away from sort of liquid calories and liquid sugar, like soft drinks. And then any sort of fast food, pre-cooked meals, these tend to be highly processed. And the processing techniques, they will often leach out nutrients, essential nutrients that we're looking to get from the food itself. So when we look at couples who are trying to conceive, those who are consuming the Mediterranean diet or are adhering to it the closest as possible, we see that their time to conception, so the time it takes in order to conceive, is less. And then we also see, and depending on the population group that we're looking at, but say, for example, with PCOS, we see that women who are following the Mediterranean diet They tend to lose weight using this, so their body weight normalizes, and that can actually decrease the chances of pregnancy loss, which is a risk factor for this population. So individuals with PCOS have higher rates of miscarriage. We do see that diet can help to normalize some of the hormone dysregulation that we see with PCOS and can help improve the likelihood of a healthy pregnancy.
Okay, yeah, that's great information. Yeah, definitely cleaning up your diet is going to have a huge impact. Now, what about lifestyle? And I know even, your nutrients in the sense of like the foods that we're eating and making sure that they're nutrient dense foods, but are there, is there specific nutrient supplements, like that type of thing? Do you use those in your practice? So
Yeah, definitely. So when it comes to lifestyle strategies, if we take a step back and look at the body, it's obvious that the whole body is connected, right? And so I always say, we're looking at it kind of through the lens of a systems biology approach. Every single part of the body can potentially affect one another. So when you talk about lifestyle, we talk about things like exercise, stress management, and sleep quality. And the reason these are important is because it'll have different effects throughout the system and have either direct or indirect influences on fertility. So with exercise, the recommendation is about 150 minutes of exercise a week. Now that can be a moderate intensity. You want about 30 minutes of sustained exercise at a time. And the max is really around 300 minutes. Now, that's not to say that people who are athletes and they're exercising more don't get pregnant. These are just sort of general guidelines. And with exercise, it's important because we're looking to increase blood flow to the actual reproductive organs. So we see that it can help improve blood flow, help with nutrient delivery, as well as removal of waste products in the area. We see that it can help to regulate insulin. It can improve sleep quality. It's a great stress reliever. And if anyone's going through the fertility journey, it can definitely be stressful. So finding ways to manage stress in a healthy way is really key. So I work with patients and the exercise piece about, what is that, what does that look like for you? I always call it movement as opposed to exercise, because a lot of people think I'm going to exercise, that means I have to go to the gym, I'm going to hate it, So it's about working to find, what is best for you, what's going to work with your schedule, what's the timing, what do you consider fun, what are you going to sustain? Because we know that the habits that we create during the preconception period are most likely to be followed throughout pregnancy. And when we see that exercise is maintained throughout pregnancy, it lowers the risk factor for a number of pregnancy complications. So again, we're helping with blood flow to the placenta and the growing embryo and fetus. That will reduce risks of things like small, for gestational age, a small embryo, or a preterm birth. And we can see it can help with reducing gestational diabetes risk as well. I talked a little bit about sleep as well. So that's always important. What are the habits prior to going to bed? So what we call sleep hygiene. The biggest common factor that I see is screen time. People are on their screens, they're being exposed to the blue light that comes from these electronics. And we know that actually downregulates melatonin. And melatonin is the key hormone that we find helps with sleep onset and maintenance. And what's interesting about melatonin, in the sleep studies that have been done, it seems like there's an indirect cause, to fertility, but we know melatonin itself has a key role in fertility, not only as to regulate sleep, but also it's been shown to help improve egg quality in women going through IVF. So particularly women past the age of 35, we know that because we have all the eggs that are present at birth, as we age, those eggs actually age as well. And the aging process, what it's introducing is the likelihood of more DNA damage or abnormalities that we'll see. So if the genes and the chromosomes are abnormal, that increases likelihood for pregnancy loss. And we see that as we get older. There's a decrease in fertility rates. It can take longer to get pregnant, and then we can see a higher likelihood of pregnancy loss. So kind of moving into some of those supplements that I use, I think most people have heard, I'll go through kind of the top ones that we hear about, and then I'll talk a little bit about some of the modifications and individualizations that can be important. So the big one you'll hear all the time, every woman should be on folic acid. This isn't a prenatal vitamin. So this is making sure that essentially you're getting the base nutrients in the prenatal vitamin that has been shown to reduce chances of pregnancy complications like neural tube defect. And then we also, what's interesting about the prenatal vitamin is you'll see variations in the forms of those nutrients as well as the dosing of that nutrient. So with prenatal vitamins, there are genetic variations that we see. Some people can't process the folic acid as readily. So folic acid is synthetic. The body has to convert it into a usable form. And there are genetic variations which can reduce the capacity by 90%. So in this case, rather than using folic acid, we might use a combined folic acid and what's called methylfolate. So that's something that people should be aware of. Sometimes in prenatal vitamins, they'll include iron, which can be really important. So make sure that you're getting your iron tested. But for those who have a history of endometriosis or sometimes chronic inflammation, thalassemia, iron is actually contraindicated in that case. And then we'll also look at the type of vitamin A that's included in the prenatal vitamin. So sometimes you'll see beta carotene. This is the pre form. This is what the body uses to make vitamin A. Or sometimes you'll see the active vitamin A. And for those who are vegan or vegetarian and not getting a lot of preformed vitamin A, or there's genetic variations that we see where people can't convert as readily, then having a little bit of that active vitamin A is going to be important. And it's important to do proper dosing because it can be toxic during early pregnancy. And then my favorite vitamins is choline. So choline doesn't have a lot of airtime, I find, but it is so important. Choline, it's actually a derivative of a B vitamin, but it's used throughout the body for a number of different reasons. And we see it's really important for the brain and spinal cord development of the baby, but it also helps with placental development. And of course, going back to genetic predispositions, we see that if dietary intake isn't sufficient, then and there's genetic variations, then we can see that people are at an increased risk for a reduction in choline availability. So we do see relationship with preeclampsia. We do see in men non-alcoholic fatty liver disease. So this can be something that can be important to include in a prenatal vitamin or taking it on its own just to make sure that you're getting an ample dose. So that's a long-winded answer on prenatal vitamins. It's such a simple thing to take, but there's actually a lot of things that we consider in choosing the prenatal vitamin. You'll also see a lot of nutrients that are supporting the egg quality or sperm quality. And typically these are antioxidants, and it's helping to protect the egg and sperm against oxidative stress or DNA damage, that aging process that's occurring naturally as we age, but also as we're exposed to different environmental exposures. So you'll see CoQ10 most commonly used, and the dose will range dependent on the age. Again, we'll look at certain parameters and see, are there any signs of premature ovarian failure or diminished ovarian reserve, that can give us indications that the biological age and the, chronological age are different. So we can do doses up to, 600, 800 milligrams. And there are studies showing that for people going through IVF, this can help to improve embryo quality and pregnancy rate. We also use it in males as well. So it is shown to help with male infertility, and again, helping with some of the sperm parameters that we look at. So there's quite commonly testing that's done. And for males, that would be a semen analysis. So semen analysis kind of looks at what's the concentration, how many sperm are present, what are the motility, are they able to move and actually get to the goalpost, are they able to swim up and meet the egg as expected, and then the shape, so the morphology. And that, these are usually clues that there's something going on if these come back abnormal. So there's other tests that can be done as well called DNA fragmentation. So that's specifically looking at the fragmentation within the sperm, which is a reflection of this oxidative damage or stress that's occurring, often environmentally. So when we look at these nutrients, we can see CoQ10, L-carnitine, omega-3. All of these are commonly used to help with semen parameters, to help with male infertility. We also use them in female fertility and egg support as well. So L-carnitine doesn't get a lot of airtime as well. This is essentially helping to take the CoQ10 and shuttle it into the part of the cell where we need it to go, which is the mitochondria. So that's something that I see missing in a lot of protocols, especially if people are protein deficient. Carnitine it's an amino acid, it comes from protein. So especially important for those who aren't eating enough protein to supplement, as well as if you're taking very high doses of CoQ10, then we see that the L-carnitine can help improve pregnancy rate, and in PCOS, even improve menstrual regularity.
Wow, yeah, that's a lot of information. That's great. And I'm sure like how you spoke about in like the dietary part, the lifestyle factors, even with like sleep and stress and exercise. I'm sure this is probably part of your virtual fertility essentials program, that you're probably talking to a lot of people about this, right? And then obviously with the supplementation, like that's going to be based on the specific needs of the individual, the couple, that type of thing. But you mentioned a number of times, and I want to get into this, is that genetic, whether it's the predisposition, but really the piece of the genetics, because I think this is something that is fascinating. A lot of people really aren't talking too much about it, but it's very much cutting edge. And now that we're able to really analyze these genetic reports that are coming to us, it's fantastic that you can really individualize patient plans. So really, if we can just, ask one kind of main question about this, is like, if you're able to kind of explain that role of genetics in fertility, and then how understanding really like each individual's unique genes can help them with that personalized treatment plan. So if we can just kind of touch on that would be great.
Yeah, happy to. So we're in a really exciting time, because now we're seeing an era of personalized medicine. And it's not that we haven't personalized or individualized medicine prior. We're always looking at past medical history and, an individual's current symptoms and kind of what's going on. But now we have their genetic data, and what your genes are is kind of like an instruction manual for how your cells function, but also how they respond to the environment. So when we're looking at particular genes, what we're talking about today is lifestyle and nutrient genetic panels. There's all different types of genetic tests out there, but the ones that we're looking at are the genes that are going to play a role in the delivery of those nutrients, how we're processing those nutrients, and helping us to understand your individual needs. And so what that looks like is, what is the actual dose of those nutrients that you require? Are you at risk for deficiency? Do we need to do a little bit more digging into your diet, what you're taking, where you're getting these nutrients, what form are you getting them? And do we need to do some blood work? Sometimes these nutrients aren't tested commonly through your medical doctor or fertility clinic. So it's important to understand what is the susceptibility and then test them and then know what is the dose and what is the form. So we can see it help with the prescription that's given for supplements. We can also look at it from the standpoint of how are you going to respond to different dietary interventions. So when we're looking at dietary interventions, there's a goal that we're trying to achieve when we prescribe a particular diet. So if someone has PCOS or they have insulin resistance, maybe they're dealing with weight gain, they're trying to lose some weight, or they have endometriosis. All of these are different aspects of their genes as well as their body of how they're going to respond to certain dietary interventions. So what's interesting about this is when you look at, two separate populations and you give the exact same diet, do we expect those people to respond exactly the same way, even if they're following it 100%? No, not really. And we know we're not going to expect that because there's genetic variations. And we see this, that from ancestral, genes. So we see that passed on from where we were derived from. What was the diet that our ancestors grew up on? This changes our chemistry and it changes our genes and how we respond to the environment. So we can look at certain genes, we can see, are there risk factors for these commonly seen lifestyle diseases like obesity, type 2 diabetes, metabolic syndrome? All of these have an impact on the fertility process, so maturation of sperm and egg, as well as pregnancy complications. So it's in our best interest to make sure that we identify these risk factors and then provide the proper diet according to their genetics, their history, and what we know is going to be the most effective. So that's one aspect of it from the dietary standpoint. And then we also know, which can be helpful for people going through this process, especially if they've experienced maybe years of infertility or they've gone to see a fertility doctor and they aren't, they're going through the whole gamut of tests, but nothing is coming back sort of abnormal, which on one hand can be good. You don't necessarily want a diagnosis, but on the other hand, it also leaves questions like, well, why isn't this working? And we've started to see some interesting patterns come up, so that we are looking at genes that relate to fertility factors and risk for infertility with both male and female. And so when these genes are present, it helps us to understand some of these, what we call microfertility issues. So issues where there's a higher likelihood for DNA damage, or they're not integrating that folic acid appropriately, so they're not getting that into the DNA repair. We're seeing maybe risk for infections, and these are dormant infections that are perhaps impacting the uterine microbiome. So it really helps to uncover these things and give us some more insight into a person's case. So I always describe the genetic panel kind of like a roadmap. It gives you an understanding about you, an instruction manual, but it also gives you steps that you can take in your diet, in your lifestyle, in your supplements, as well as working with your doctor to kind of understand some of these conditions that you may have a predisposition for that may be impacting your fertility and it hasn't been uncovered previously.
Mm-hmm. Yeah, I think that's fantastic because this truly is that, personalized medicine piece. And it's not just a matter of, somebody going and picking up a prenatal vitamin off the shelf and picking anyone, especially if there's fertility issues, really figuring out what is specific to that person versus, just the blanket statement of fertility issues, right, and concerns. So it's amazing that you are doing this and really incorporating this into your practice and giving people that like personalized approach that they really need. So that's fantastic. And I just want to say thank you so much, Dr. Robyn, for being here today with us. It's been wonderful, great information. We'll have all of your contact information readily available because I'm sure everybody's interested in this. So yes, thank you again so much for joining us today.
Excellent. Thank you so much for having me. And it's such a pleasure. And happy to answer any questions if people want to reach out and connect with me.
Wonderful. Thank you. Take care.